video, I'm just going to look at assessment item 1, critique of the advanced practice nurse, because it's really important that you understand what's expected and don't try and sort of add too much or don't provide enough. So the first thing is to really look over the criteria. So in this task, you're discussing the historical development of the role of advanced practice nurse in relation to your own clinical context. Then you're sort of looking at summarising what they do. So the first aspect is, why was it developed? Second aspect, summarise it. Third, critique it, and then conclude by making a evaluative statement. So historical development is 200 words, so it's not a lot. So you want an intro sentence, discuss the development. So why was this advanced practice role developed? Where, what changes, and so if you're looking at sort of maybe you had a lot of older patients who were being discharged and then were being readmitted with concerns, so your ward area may have developed a geriatric specialist nurse or a discharge specialist nurse. So this is an advanced practice role developed to reduce readmissions. You could then put up some references about readmissions and that acute follow-up and discussion and family meetings will improve and reduce readmissions of older patients. So that is then the information about the historical development, but also the references to actually understand why this was needed. The second part, summarise your practice roles nurse. So what population do they see? What is their roles? And make sure you're referencing this with best practice. So what is the role? So if this was a discharge registered nurse that was working in an advanced practice role, they may see any patient over the age of 70 that is being discharged home to a home area with family. So their main role is to ensure the family understand that there's links with community, that they have aspects of medications, wound care, etc., all covered and understanding, and the family know this. And then you could reference that by saying that having the family integrated into the role and to the discharge of a patient will improve their outcomes. And looking at critiquing the role. So what is the best practice? And this is where you could actually say, you know, that discharge registered nurses working in an advanced practice role have improved, reduced readmission or reduced concerns because of the fact that medications have been understood and followed appropriately, that wounds have been followed up appropriately, that admissions have been able to be shortened because there's the setup for the home care provided. So this is all that evidence of the role. And making then the last part with your concluding statement that you link it to the role and the domains of the advanced practice. And so think about, so if this is actually educational role, that you're making a statement that looks at sort of in relation to the role of the advanced practitioner to ensure that there is education to the patient and family at a level that is understood by them, then you can conclude by saying that this role has been developed to ensure that education needs of the patient and family are met, and then the reference that goes with that. And then just to remind you that those 4 domains across 4 standards. So education, research, leadership and clinical are the domains, and then education, it's that assessment, planning, implementation and evaluation across those. So advanced practice nurse will assess the health literacy levels and make a plan about education, implement it, and then evaluate if this patient's education has actually been understood by maybe a teach-back process or the fact that the family are able to understand and re-inform you of their plans. Thank you.